Overcoming the stigma of mental illness. What is stigma? Stigma involves negative attitudes or discrimination against someone based on the distinguishing characteristics such as a mental illness, health condition, or disability. Social stigmas can also be related to other characteristics including gender, sexuality, race, religion, and culture. Unfortunately, stigma surrounding mental health is still common. While stigma is not limited to mental conditions, attitudes toward psychiatric illnesses tend to be more negative than toward medical conditions. The consequences of stigma can be serious and devastating. With stigma comes a lack of understanding from others, which can be invalidating and painful, but stigma also carries more serious consequences, including fueling anger, fear, and intolerance directed at other people. People who are subjected to stigma are more likely to experience reluctance to seek out treatment, delayed treatment, which increases morbidity and mortality, social rejection, avoidance, and isolation, worse psychological well-being, poor understanding among friends and family, harassment, violence, and bullying, poor quality of life, disability, and increased socioeconomic burden, increased feelings of shame and self-doubt. The stigma surrounding mental health can make it less likely that people will seek treatment. Some conditions may worsen over time without treatment, so failing to seek treatment ultimately worsens outcomes. Stigma can also cause people to doubt themselves and their abilities to achieve their goals in life. Researchers identified different types of stigma. Public stigma involves the negative or discriminatory attitudes that others have about mental illness. Self-stigma refers to the negative attitudes, including internalized shame, that people with mental illness have about their own condition. Institutional stigma is more systematic, involving policies of government and private organizations that intentionally or unintentionally limit opportunities for people with mental illness. Examples include lower funding for mental illness research or fewer mental health services relative to other health care. Stigma not only directly affects individuals with mental illness, but also the loved ones who support them, often including their family members. Harmful effects of stigma and discrimination. Stigma and discrimination can contribute to worsening symptoms and reduce likelihood of getting treatment. A recent extensive review of research found that self-stigma leads to negative effects on recovery among people diagnosed with severe mental illnesses. Effects can include reduced hope, lower self-esteem, increased psychiatric symptoms, difficulties with social relationships, reduced likelihood of staying with treatment, and more difficulties at work. Stigma in the workplace. Only about 1 in 5 workers were completely comfortable talking about mental health issues. The poll found a generational divide. Millennials were almost twice as likely as baby boomers to be comfortable discussing their mental health. On a more positive note, about half of workers were at least somewhat comfortable talking about mental health, and most workers said they would help guide a troubled coworker to mental health resources. However, even among those willing to help, about 1 in 4 workers said they would not know where to turn for mental health help. With a growing number of people experiencing a decline in their mental health, society is becoming better equipped to respond to our needs. However, the stigma around mental illness and seeking help remains. More than 50% of U.S. adults will need mental health treatment at some point in their lifetime. In addition, 1 in 25 are currently living with a serious mental illness such as an eating disorder, bipolar disorder, post-traumatic stress disorder, or major depression. A national survey estimates that 11.2% of all U.S. adults report regularly feeling some form of worry, nervousness, or anxiety, while 4.7% report frequently experiencing sadness or symptoms of depression. Given how common it is for people to experience a decline in mental health, the level of stigma that exists in society is surprising and often contradictory. Mental health stigma can come from stereotypes, which are simplified or generalized beliefs of representations of entire groups of people that are often inaccurate, negative, and offensive. They also allow a person to make quick judgments about others based on a few defining characteristics, which they then apply to everyone in that group. For instance, people living with depression are often stereotyped as lazy, while some judge those with anxiety as cowardly. Many people fear being labeled crazy for simply seeking support from a therapist. None of these characterizations are valid, and all of them are misinformed, cause pain, and prevent people from getting the help they need. An often politicized stereotype about people with mental illness is that they are violent or dangerous. However, a small minority of people living with mental illness commit violent acts. They are actually 10 times more likely to be victims of a crime, making them a vulnerable population we should be protecting instead of fearing. Stigma may not be obvious or be expressed in large gestures. It can come in the words people use to describe a mental health condition or people living with mental illness. This can involve hurtful, offensive, or dismissive language, which can be upsetting for people to hear. This can cause them to feel alone and that no one understands what they are going through. The effects of stigma can include internalization of negative beliefs, social isolation, low self-esteem, hopelessness, shame, avoiding treatment, worsening symptoms, lack of criminal justice, discrimination at work, and unemployment. Most people who live with mental illness have, at some point, been blamed for their condition. They've been called names. Their symptoms have been referred to as a phase or something they can control if they only tried. They have been illegally discriminated against with no justice. This is the unwieldy power that stigma holds. How to overcome mental health stigma. Public education to increase knowledge around mental illness is paramount, since the majority of stigma comes from lack of understanding and misplaced fear. It is important to review reliable sources of information on mental health conditions and become better informed when learning that a friend, family member, or coworker is living with a mental illness. At the individual level, a person with a mental illness can get actively involved in their treatment. They could also consider getting an advocate if they feel that stigma impacts their ability to navigate day-to-day circumstances such as employment, housing, or health care. An advocate is a trained professional who helps people work through employment disputes, medical appointments, financial claims and appointments, and housing problems. They support the rights of owners who may not have the strength or knowledge to do so on their own. To decrease stigma, talk openly about mental health. Educate yourself and others, and be conscious of language. You can see what these people have said about their own mental health issues. In addition, encourage equality between physical and mental illness, show compassion for those with mental illness, and choose empowerment over shame. Finally, be honest about treatment and don't harbor self-stigma. Importantly, everyone has a role in diffusing mental health stigma. People should educate themselves about mental health issues and better comprehend what life is like for those living with these conditions. By doing so, they can help dispel commonly held myths and stereotypes both in themselves and others. Through education and understanding, we can eliminate the stigma around mental illness, and there is support available to people who are currently experiencing stigma.